Patchy beard growth is more common than you think. For many men, beard gaps are not about genetics alone. Hormonal factors, skin conditions, and growth cycles also play a role. The most common mistake is rushing into treatment without understanding the real cause. Not every beard gap needs a transplant. In some cases, non-surgical solutions can improve density and quality. When transplantation is the right option, the goal is always a natural result. Designed to match your face, not a template. At Leila Medical, every beard solution starts with analysis, not assumptions.